Good morning, everybody. How's everybody doing? Oh, you guys can do better than that. How's everybody doing today? All right, all right. That's much better. I want to be the first to welcome you guys to what we have today is a wonderful, wonderful programming. We're going to be talking about health equity, but not just health equity in action, right? And I want to be the first to speak to you guys. And actually, I want to start by thanking the folks that are responsible for putting this day together. First and foremost, the Multicultural Health Equity Collective at Pfizer, the National Caucus of Native American State Legislators, the Century Foundation, Morehouse School of Medicine, and the National Association of County and City Health Officials. Those are the sponsors, folks. You're supposed to clap for them. All right, good, good, good. All right, so a little bit about me. My name is Nate Garcia. I hail from New York City, more specifically the Bronx. You're supposed to clap for the Bronx too. There you go. All right, good, good. Now we're cooking. All right. I don't know if you guys know a lot about the Bronx, but it doesn't have the best reputation. And as a kid growing up, I always wanted to be in healthcare. I thought I was going to go the clinical route. I thought I was going to be an MD. As I grew, though, I started to be a little bit more cognizant about healthcare, right? I started to notice that all of the doctor's appointments my mom took me to were on the better side of town, more specifically in Westchester, right? I started to understand that the folks that were my friends growing up, my classmates, my neighborhood friends, they didn't have access to the same kind of care that I did. And I started to wonder why that might be. And is it just because my mom is anal retentive? No. But my mom didn't have a language barrier. We had access to a car. We had access to knowledge. We had healthcare professionals in our family. And we had champions that really, really cared about our health and were educated well enough to know the difference. When I got to high school, I think it was my ninth grade year, I took my first health class. And I started to understand, as I was in a private school in New York City, and one of only two people of color in my grade, that a lot of the afflictions and the chronic diseases that we were learning about, I knew somebody or somebody in my family who was afflicted with them. And I started to notice that that wasn't the case for my counterparts. And I started to put the puzzle pieces together as to why could that be, right? Why is it that me and the folks that I know and the neighborhood that I'm in and the zip code that I occupy are disproportionately affected with the diseases that I'm learning about in these classes? And when you start to think about those things, you start to put those puzzle pieces together, I think you start to realize that health equity is a thing. And now, I'm not going to tell you how old I am, but I'll tell you that health equity wasn't the topic when I was in school, right? And so as the son of immigrants, it was doctor, lawyer, engineer, right? Masters in public health wasn't on the table. But as I grew and became more literate and became more aware of the situation, I kind of naturally found myself moving towards health equity, right? Or equity in spaces in general. And so a little bit more about me. I'm educated as a biology student. I was on the pre-med track. I kind of wandered into a laboratory one day and fell in love with the bench, and then it took me a long time to get out. I'm formally trained as a vaccine scientist, hailing from Pearl River, New York. That's our Pfizer's vaccines headquarters. I've worked on all of the vaccines that have come out in the last 5 or so years, including the COVID vaccine, but more specifically, my baby's RSV. That one's actually really cool, disproportionately affects people of color, especially infants. And scientists have been working on that one since the 1950s. We were the first company to get an approval for a maternal vaccine for RSV. You clap again for that. Okay, good, good. Now you're with me, all right. A little over a year ago, I decided to join or leave the laboratory and join the CEO's office to work on an initiative, the Pfizer School of Science, where we strive to educate young students, the middle school age in New York City, and get them excited about careers in STEM. You guys are probably familiar with early talent pipelines, right? And folks that are getting the next generation of scientists and folks ready to join the workforce. I like to think of my job as like early talent pipeline, right? And more specifically, if we're looking to see change in health equity, right, you got to make sure that the folks that are providing care and the folks that are sitting in these board seats and the folks that are leading these initiatives at pharmaceutical companies like Pfizer look like the populations they're meant to serve, right? And so it's really important for me, at least, in my personal mission, to make sure that we are educating folks at a young age and making sure that they're aware of the possibilities of well-paying, in-demand careers that can actually make the world a healthier place for people that look like them. So I think you've heard enough about me, right? We're going to be talking a little bit about why health or diversity in the healthcare field matters, right? And I have a panel of extremely esteemed guests. And I'd like for all of you guys, if you can, to take a moment to introduce yourselves. And while you do so, I'd like to hear about the why and the motivation of how you found yourselves in the careers that you are and what keeps you motivated to keep pushing forward every day. Connor, would you mind? Testing.
Can you hear me? All right, is this good?
Good.
Good morning, everybody. I'm really thrilled to be here. My name is Kama Ennis. I am an emergency physician by training, and I come to that through being an immigrant from Jamaica as a very young child, background in education that started in medical anthropology, and a sidestep into public health during medical school because I felt like it was getting so narrow and I could only see diseases, I couldn't see people anymore. So I took a step out between my third and fourth year so I could get back the forest for the trees. And then did my training in emergency medicine and rose to the position of being the medical director and chief of the department. But when I needed to shift gears, when I needed to change my own career path and looking to hire people, I realized that I was one of only 2 Black physicians in the hospital, and that my leaving would have a much broader impact than just, needing to replace a person, a body at the bedside. So, looking to see what I could do to move towards diversity in medicine, I peeled back the layers of the onion and ended up creating a project called Faces of Medicine, which is a way to use storytelling to show people themselves in our stories. I wanted people who have never seen themselves represented at the bedside to know what is possible, and I wanted to find a way to get folks where they are, where they live, and show people who are first-generation college graduates, immigrants, people who took the MCAT 3 times before getting a score that could get them into medical school, because those aren't the stories that are told, but those are the stories that are very much out there. And I think it's part of what's going to help us increase representation in medicine and ultimately improve disparities, because we know that there's a real impact when our providers and our clinicians don't reflect the communities that we serve. And that is how I ended up here. So thank you.
Awesome. Thank you. Welcome, Connor. Monique.
Good morning. My name is Monique Miles, and I serve as a vice president at the Aspen Institute. In some ways, I may be a little bit of an interloper because while my work is not directly, squarely in the wheelhouse of healthcare, the work that I lead here in the United States supports rural, indigenous, and urban communities to redesign education and career pathways so that we are not only removing barriers to opportunity for youth and young adults of color, but we are thinking about how do we center everything that Black and brown young people need to be successful in whatever it is that they endeavor, whatever their purpose is. How do we hold race, identity, culture, community at the center of meaningfully supporting the next generation of youth and young adults of color so that they not only, again, are functioning in their purpose, but also a part of the civic fabric of our society. And my why, I think you're going to hear the same themes resonating throughout our conversation here this morning. I sit here because I am the reflection of my ancestors' dreams. I know that somebody generations before me was thinking of me, was praying for me, and was doing the work to pay it forward to create space for me. And very similar to the story that Nate told, I remember growing up Harlem, El Barrio, so out, okay? It's the sensing and feeling. You feel inequity, but you don't have the language. You feel the unfairness of the system, but you don't quite understand. And so every opportunity I received was deeply knitted in this idea of lifting as I climb. And so my why is very much about not just honoring my ancestors, but doing work that is ensuring that at least 7 generations after me will have access to the opportunities that they deserve.
Awesome. Awesome. Welcome, Monique. Peace.
Hi, everyone. My name is Pisa Poco, and I'm the president of the Student National Medical Association at the OU College of Medicine chapter. I'm currently a second-year medical student, but kind of as Kama was alluding to, the road to get here was not easy by any means. There's a lot of barriers, setbacks, and discouragement along the way. So it was really important for me to get involved with SNMA because it's an organization that for over 60 years has been committed to not only getting Black and brown students into medicine, but making sure that we stay in medicine and thrive in medicine. So it's really important for me and the work that I do in this organization to empower middle school students, high school students, college students to get to where I am, and for all of us to collectively impact our communities in a positive way. Thank you.
Awesome. Thank you, Peace. Welcome. Bobby, that one works.
Hey, honey, lakchi. Chante washte na pe choose up a little. Bobby puyer machi apolo and inana ate Cecilia Bikro and Bapuyer iwichaki api. Oglala lakota hamacha makpia wankantia lakolchaje machi api. Good morning, everyone. I shake your hands with a good heart. My name is Bobby Puyer. I come from the great and mighty warriors of the Great Plains, the Oglala Lakota. We are the people who killed Custer, only people to ever beat the United States in battle, and we're still really, really proud of that today. So I am Oglala Lakota, born, raised, and living on the Pine Ridge Indian Reservation in South Dakota. I currently am the program director of a suicide intervention program through Johns Hopkins University that does intervention work on the Fort Belknap Indian Reservation with hope that in the future we'll expand our work onto my reservation and my home community. I'll speak about my program. Our program is called the Young Medicine Movement, and our entire ethos and the crux of our program is treating suicide intervention through giving and providing and supporting young Native students with pathways into careers that will directly address and reduce their suicide risk through improving community health. And so we do all kinds of work in the health and STEM career fields. And now we are in our third year of operation, so we have college students now. And we're supporting them all the way up through graduate school. And the work that we do, I'll speak more about it in our conversation. But it's always been really inspiring for me. Getting to my why, growing up on Pine Ridge, I always like to really heavily lean on our proud history and our warrior culture and our accomplishments and being really proud of who I am, because unfortunately, if you've also heard of Pine Ridge, you've probably heard of our alcohol rates and intimate partner violence rates and unemployment, and you've heard a lot of these poverty statistics, and I really don't like to think of my community through a poverty mindset. And so a large part of my why was that whenever I was growing up, my mother was a researcher and my dad was a teacher, and I was constantly kind of impacted by the kind of home that they were able to provide for me. Both my parents had their issues with substance and alcohol abuse, but whenever I was born, they broke that cycle. And whenever we get back to our indigenous communities, that's like our headline right now, is breaking those cycles. And so my parents broke a cycle for me, allowed me to grow up in a home free of substance and alcohol abuse. But that meant that I would go to school and I would be around my friends who didn't have that same privilege, who didn't have the same foundation for which they could pursue their education from. And I really felt that and I saw it. And so from a very early age, it became my kind of lifelong commitment and goal to be able to provide the home that I had to other communities and to other families on my reservation. And so that's kind of been like my steering compass. I also like to say that everything that I do because my mom told me to. So from a very early age, she was like, you have to get your PhD and you have to go to college and become a researcher like me. And my dad was like, yeah, do that. She's smarter than I am. So my big why is my mom. But really, it's for the future of our communities. And coming from a school of public health as well, you really take a perspective at a populations level. and also from like our indigenous cultural knowledge, we really know that our children are our future. And so it's all about planting seeds of trees that you won't be around for. And so our whole program is built around planting those seeds and supporting youth through career fields that'll improve their communities. Pilamiaya, thank you.
We'll see if that's a good one.
I think so.
Oh.
It works. Okay,
Veronica, please.
perfect. So good morning, everyone. My name is Doctora Veronica Vital. I am the president of the National Association of Hispanic Nurses, and then I also am an assistant professor at Alverno College. So the Hispanic Nurses, we've been in existence for about 50 years. We are a collective voice representing over 300,000 nurses, Hispanic nurses across the nation. We have about 50 chapters across the nation as well. And our mission is to make sure that we're promoting the health of our Hispanic communities and also promoting and advancing leadership and educational opportunities for Hispanic nurses. My why is, I'll say my why. I was a single teenage mama. So I had my son in high school. And so I was told that I wasn't going to accomplish anything after having a baby in high school. So I had to not be a statistic. So I decided to go to college. But when I was in college, I was the only one of my siblings. There's 7 of us. And so I was the only one who went to college. But while I was in college, I was the only Latina who was in my program. And so I struggled with that. I had the imposter syndrome. I felt like I wasn't smart enough. I wasn't good enough. Everybody around me looked smart. So I almost dropped out. And so I struggled with that. And so I was blessed to meet NAN. I was blessed to be introduced to NAN, and they empowered me. They took me under their wings, and they helped me through finishing my BSN, and then taught me how to be a leader. And so as a new grad, they embraced me, and I had won a scholarship from them. And they had told me when I graduated as a new graduate, they said, you're going to earn your scholarship and you're going to be president of the local chapter. So as a new grad, I was like, I don't know how to do this. But they embraced me, they taught me, and so now my why is to pay it forward, to make sure that others have a voice, for others to feel empowered as well, and to know that we are capable and we have the capacity to excel and be leaders in our community. So we're a collective voice for our communities, and we want to make sure that we are impactful and making a difference in the health of our communities. So that was my why. So thank you. Thank you.
Incredible, incredible. All right, you guys are all feeling mighty inspired by now, I hope. All right, good, let's go. It's time to, no, all right. Setting the bar high, guys, I'll be honest with you. And so thank you so much for those intros. I feel connected to you guys in a strange way. I know we only met today, but I feel that given our whys and given the work that we choose to do, right, and the mission that we share, there's a lot that we give of ourselves, right, and all too often I think there are a lot of obstacles in the work that we do. And so I'm very interested to hear your perspectives on a couple of other things we're going to talk about in this conversation. First being, though, how do you guys feel, and through your perspective and maybe through the lens of your respective industries, having a diverse workforce may impact the health outcomes of minoritized communities? Please, yeah.
So I think the impact of having a diverse workforce cannot be underestimated. There are data that show that infant mortality can be reduced. The disparity in black and white infant mortality can be reduced by 50% if there's a black pediatrician involved. There are data that show that life expectancy for minoritized communities improves when there's diversity in the primary care workforce. There are data, so it's irrefutable. It's not a photo op. It's not, a statement that gets written somewhere. It has a real life and death impact, and I think there are very few measures that can have that level of impact on real people and real families and reduce suffering in the way that we need it to happen. And I think it also, having a diverse workforce allows people who are minoritized to see themselves in these spaces, to see what is possible, to know that there is a seat at the table for them, for us, and that this is our space as much as it is anybody else's.
I would add to that just a few things. The first is that if we truly are able to achieve a vision of a diverse workforce, it means a couple of things are true. It means that youth and young adults of color have access to education and career pathways, which is another way of saying that they have means to achieve economic and social mobility. So that is just really important. We're talking about supporting young people to thrive. The second thing is that particularly for every youth and young adult of color, we know that every time a young person, this is my story, we heard everybody and their why share a similar story, every time a young person achieves a secondary credential, a post-secondary credential, meaningful connection to career pathways, that has a generational ripple. They come back home and they start speaking differently to their parents. They start speaking differently to their children. I mean, we heard people here tell us stories about what it meant for someone close to them to achieve this type of goal. So we also know that there's a generational impact, a generational ripple that we cannot measure, but it's critical to the health and well-being of our society. The next thing that I want to say that we also heard echo in our stories is it's especially important because people of color serve as translators. When young people are able to participate in a diverse workforce, in a diverse economy, what they are doing is taking some of the science that we heard people speaking to and helping their parents understand what that means, helping their cousins and their peers understand what that means. It's access to information that they can leverage for their own purpose. It opens the door, it widens it in ways that allow future generations to come through. And then there's this other piece that's so important. Having a diverse workforce is how we get to the promise of our democracy. The promise of a multiracial democracy that works for everyone is part and parcel of being able to have young people meaningfully participate in the workforce and having it reflect them in ways that help us get to a much more inclusive democracy, because what we're talking about is not just agency, but we're talking about self-determination in ways that help our communities, in ways that help young people to thrive, in ways that help families.